Makita rin ninyo akong slides, guys. Dayo madungog na ko ninyong tarong.
Yes, ma'am.
Okay, sige, ma'am. Thank you. Under Cabinet 5, I will be discussing about cough and cold preparations, radiographic and diagnostic agents, alkalinizing agents, topical creams and ointments, vasoconstrictors, nasal decongestants, and other nasal preparations, plasma volume expanders, and loose tablets. So let's first discuss about cough and cold preparation. So before we dive into the different medicines for cough and colds, let us first discuss about the common cold. So, I know familiar naman mo and kabalo na mo that a common cold is caused by viruses. So, it is a viral infection and it is very contagious. Although viral infection man siya, so it is possible nga mawala or ni siya after a couple of days or weeks. But in order to alleviate the symptoms, like common symptoms of cough and colds includes tickly throat, runny or stuffy nose, sneezing, ang uban pagani kay magka sore throat, headache, and some would suffer from cough due to postnasal drip. So in order to alleviate or to minimize these symptoms, atong tagaan na to ang mga patients of cold medicine. So these are a group of medications taken either individually or in combination as a treatment for the symptoms of the common cold and similar conditions of the upper respiratory tract. So first medicine, we have butamirate citrate. So the brand Senicod Forte. It is an effectual cough suppressant and works by lessening the airway resistance. So ang mechanism of action for Senicod Forte is that it is an antitussive. So when we say antitussive, it works by suppressing cough. So ang Senicod Forte atong ihatag for persons nga naay dry cough. So it works by acting on the cough center in the brain and decreases the sensitivity of cough receptors. So muni siya atong ihatag sa mga patients nga na ay cough na walay phlegm. So, muna ang Senicod Forte. Next, we have doxophilin. So, we have the brand Ansimar. It comes in two dosage strengths. We have 200 milligrams and 400 milligrams. So, it is a methylxanthine derivative used in chronic obstructive pulmonary disease, asthma, and bronchospasm. So, doxophilin, it is a bronchodilator. So, when we say bronchodilator, it relaxes or it opens the airways in order to relieve chest tightness, wheezing, and cough so that the patients will be able to breathe more easily. Kay, as you can see in the example, for people nga nay asthma kay constricted good na or narrow na ilahang airways sa lungs. So muhatag taog doxophilin. So what it does is that it opens or it relaxes the airway in order for our patients to breathe easily para easy lang mo flow ang air. Okay, next we have acetylcysteine. So we have two preparations na atay effervescent tablet and sachet or granules for solution. It is an antioxidant and glutathione inducer indicated for mucolytic therapy, and it also used for paracetamol poisoning or paracetamol overdose. Fluimucil is a mucolytic. So mucolytic meaning it thins and loosens the mucus in the airways. So it helps you to clear the mucus from your lungs so that you can breathe easier. So for example, pohon, mahimo na mong community pharmacist, and then naay customer nga nipalit ninyo og fluimucil nga effervescent tablet, unsa man inyohang special instruction nga inyohang iingon sa inyohang customer? Basta gani sa fluimucil nga effervescent tablet, unsa gani to ato ang special instruction nga to ang iingon sa ato ang mga patients? Unsaon gani
Ihulog sa ugat. Ihulog siya sa water na.
Yes, very good. So, it being an effervescent tablet, dili lang siya pwede i-directly iinom. So, dapat pa niya siya pa-melt sa water. So, dapat mo dyan na guys, sa muna inyohang importante dili kaligtaan. Dapat as a pharmacist, you should never assume and you should always validate. So dili ta mahimo nga mag-expect ta nga ay kabalo na ni siya unsaon pag-take kay. For example, kaning Fluimucil, upon looking at it, it is an oral tablet. So katutawong wala kabalo, direktaon lang ni siya og inom. So dapat i-inform na to siya how to properly take the medicine. So dapat ni siya hulom sa tubig, ipa-melt ngano gani, unsa gani action, unsa gani reason nganong effervescent manggod ni ang Fluimucil. Naamoy idea, guys. Ngano man ni siyang ipalanay jud sa tubig, ngano mang dili lang pwede nga directly lang ni siya i-intake like any other oral meds. Okay, so ang Fluimucil ipamelt na to ni siya, ibutang na to ni siya sa water in order to release carbon dioxide. Kay if in contact ni siya with water, ang effervescent tablet would release carbon dioxide to promote disintegration. So, para pag inom sa patient, dali siya mo take effect. Okay, so mo to ha. Okay, next we have Erdostain, the brand name Ectrin. So, it is also a mucolytic. It is a drug that causes a breakdown of mucus, and it works by helping to break down mucus secretion. So, in order to treat cough. So, katuni parang ni siya sa mga cough with phlegm para ma-thin or ma-loosen to ang mucus para easily ma-expel sa to ang mga patients. Okay, now let's proceed to our vasoconstrictors, nasal decongestants, and other nasal preparations. Nasal congestion or stuffy nose occurs when nasal and adjacent tissues and blood vessels become swollen with excess fluid, causing a stuffy plugged feeling. Nasal congestion may or may not include a nasal discharge or runny nose. So ang uban ana nga pag naisipon kay magpingot lang ang ilong, ang uban kay naay allergic reaction like magsigig pangatching, magpula ilahang nose, or ang uban pagani kay naay red or itchy or watery eyes. Now, atong ihatag sa ato ang mga patients would be decongestant. So, these are a type of medicine that can provide short-term relief for a blocked or stuffy nose. They can help ease the symptoms of conditions such as colds and flu, hay fever and other allergic reactions, catarrh, and sinusitis. So, unsa man ato ang medicine available in the pharmacy nga for nasal decongestants. Familiar mo, nakita lang mo ato, nasa cabinet 5, unsa ganito nga mga brands.
Ato tong kuan ma'am na Farin.
Yes, very good. Naatay Nafarine A. So, ang Nafarine A, it has 3 active ingredients. Kay mostly manggod since ang common cold or if siponon ta, it is usually accompanied by allergies like magsigitag pangatching, ang uban magsakit og ulo, and fever. So, muna siyang to make it easier for the patients nga dili na siya mag-inom-inom og 3 medicine, gi-combine ni siya. So we have Nafarine A and Nasacera. So for Nafarine A, it is a combination of phenylpropanolamine. So phenylpropanolamine, it is a sympathomimetic vasoconstrictor. It is used to treat congestion associated with allergies, hay fever, sinus irritation, and the common cold. It also has chlorphenamine or chlorphenamine. So it is an antihistamine. H1 receptor antagonist indicated for the management of symptoms associated with upper respiratory allergies. And the third active ingredient is ang paracetamol or acetaminophen. So it is a medication used to treat fever and mild to moderate pain. And another brand, murag out of stock pa man as of the moment, we also carry Nasacera. So it is a combination of phenylpropanolamine and paracetamol. This is used for the relief of plugged nose, runny nose, postnasal drip, itchy and watery eyes, sneezing, headache, body aches. So kamo as future pharmacist, unsa man inyong important note, unsa man inyong upon dispensing this medicine, unsa man inyong importante i-ask sa inyong patient, inyo ang i-assess inyong pasyente kay contraindicated man ni siya. Unsa gani ni ang cold medicine contraindicated sa mga patients with.
Hypertension, ma'am.
Yes, very good. Okay, ngano man ni siyang contraindicated sa ato ang mga patients with hypertension kay maka-cause og
Vasoconstriction since nasal decongestant man ang phenylpropanolamine or phenylephrine, ma'am.
Okay, very good. So, since ang phenylpropanolamine or phenylephrine, it causes vasoconstriction. So, thus, elevating blood pressure. So, very good to thank you, Cave. So, mo nang puhon, labi na if mag-work na mo sa community, before dispensing this type of medicine, labi na nga katong nag-contain og phenylephrine or phenylpropanolamine. So, we all know nga, it would constrict blood vessels. So if constricted ang blood vessels, since dili man ni siya selective, so tanan na ni siya. So it would elevate blood pressure. So kamo, if for example, naay mo adto ninyo din mangutana nga hypertensive siya but gisipon siya, unsa man inyong ma-recommend? Sige daw be. Namoy idea if kamo puhon pangutan-an mo or sa inyong family member. Unsa man inyong ma-recommend nga medicine? Okay, so since kani manggong common cold, it is a viral infection lang man ni siya. So when we say viral infection, it would just go away on its own after a couple of days. So although inaana siya mawala rin siya, but it would come with symptoms like headache, runny nose, or sigig pangatching. So pwede na to ma-recommend sa ato ang mga pasyente nga, ma'am, since a common cold is just a viral infection, mawala lang man ni siya after a couple of days. But for you to alleviate the symptoms, ma'am, pwede kang mo take pwede ta maka-recommend og antihistamine para nga ma-alleviate ang symptoms like runny nose or kanang magsigig pangatching. And also another pod na to nga ma-recommend is for our patients to take immunity vitamins. So like sodium ascorbate with zinc. So mulang na siyang atua kay dili lang jud na to ipaimno na to ang mga patients with hypertensive cases o kanang mga vasoconstrictor. So mura na ang ato ang mga important things to remember. Okay, so let us proceed to our radiographic and diagnostic agents. So when we say diagnostic agents, these are also known as contrast agents that are administered to the patient during the imaging process of the body. In order to diagnose the disease, these imaging agents emits energy in the form of X-rays, gamma rays, sound waves or radio waves, and radioactive particles. This describes various techniques of viewing the inside of the body to help figure out the cause of an illness or injury and confirm a diagnosis. So an example, we have omnihexol. So the generic name for this is iohexol. So it contains iodine and belongs to a class of drugs known as contrast media or dyes. It works by adding contrast to body parts and fluids in this imaging test. It improves images obtained during a CT scan so that the doctors could easily diagnose your condition. So, iohexol is used to help diagnose or find problems in the brain, back, heart, head, blood vessels, stomach, joints, pancreas, bladder, reproductive tract, and other parts of the body. So, I'm sure familiar mo ani nga maka-dispense mo ani during sa mga procedures like mostly common kay kanang magpa-CT scan or magpa-MRI. So, muni ato ang contrast media nga i-dispense. Another would be Scanlax. So, it comes in two preparations. So, balantayan kaayo 300 milligrams and 370 milligrams. It is a non-ionic iodinated radiographic contrast medium. It allows visualization of internal body structures through opacification of vessels in the path. So it is also used to diagnose problems in the brain, heart, head, blood vessels, and other parts of the body. So mostly ani kay ginagamit together ang iohexol and iopamidol in order to view or to visualize and easily ma-detect ang any problems during CT scan procedures, angiography, or kanang MRI. And we also have Gadovist. Generic name ani is Gadobutrol. It is a gadolinium-based MRI contrast agent. It facilitates visualization of abnormal structures or lesions and helps in the differentiation between healthy and pathological tissue. It aids in the detection of known or suspected abnormalities in the body, brain, spinal cord, blood vessels, head and neck region, chest, breast, abdomen, pelvis, kidneys, bones, muscles, and hearts. Okay, so more lang to ang ato ang mga contrast media. So we have Omnihexol, Scanlax, and Gadovis. So let's proceed to our plasma volume expander. So these are fluids given intravenously to increase or retain the volume of fluid in the circulatory system. It comprise a heterogeneous group of substances used in medicine that are intravenously administered in cases of great blood loss owing to surgery or medical emergency. So since nakaagi naman mo og pharmacology guys, I'm sure familiar lang mo aning plasma volume expanders, but for to give an review lang, so this is how it works. So for example, we have normal lang ato ang blood vessel. So if normal ato ang blood vessel, proper lang ato ang blood circulation or blood flow. So in cases nga simba ko na ay severe accident or mo undergo og long operation ang pasyente, automatic good na nga naay pronounced blood loss or daghan nga blood loss. So if magka blood loss na ta, ato ang blood vessel would experience polytrauma. So it would collapse due to imbalance ang osmotic pressure. So if in ana imbalance ang osmotic pressure, dili na maka-retain og volume of fluid ang ato ang circulatory system. So in order to correct this scenario, muad ta og ato ang mga plasma volume expander. So ang ato ang plasma volume expander, it would enhances colloidal osmotic pressure, it would improve ang ato ang blood circulation para ma-retain gani, para dili gani mo leak or mugawas ang ato ang blood vessels or fluids, ma-retain ra siya sa ato ang blood vessels in order to have a proper blood circulation. So it is given intravenously to increase or retain the volume of fluid in the circulatory system. So mostly ang ato ang mga plasma volume expanders, ginahatag ni siya or gina-inject ni siya sa ang mga patients na to nga maka-experience og cardiogenic shock. So cardiogenic shock kana nang ato ang heart is not able to pump enough blood na kinahanglan sa body. So ang ato ang medicine nga na ani is ang ato ang human albumin. So we have two preparations na atay 20% and 25%. So ang albumin, so I'm sure kabalong mo nga, it is the most abundant plasma protein in the blood. It is a protein made by our liver. So what it does kay ang albumin enters our bloodstream and helps keep fluid from leaking out of your blood vessels into other tissues. It also carries hormones, vitamins, and enzymes throughout our body. So it is used to treat hypoalbuminemia in patients with severe injuries, infections, or pancreatitis that cannot be quickly reversed, and when nutritional supplement have been given but it did not work well. Okay, so I'm sure sige naman mo og dispense aning albumin, so muna ang iyahang action. It helps fluid from leaking out of the blood vessel. So muna siya ang example of a plasma volume expander. Okay, let's proceed, to alkalinizing agents. So these are drugs used to manage disorders associated with low pH. So for example, it is used to treat acidosis. So when we say acidosis, na ay build up of acid in the body due to kidney failure. So if um daot na or dili na high functioning ang atoang kidney, na possibility nga magka-metabolic acidosis ang isa ka person. So, metabolic acidosis, increase ang pH. So, munang mo hatag ta sa atoang alkalinizing agent. So, these are class of drugs that work by raising the pH in the blood or urine. So, i-raise ang atoang pH so para ma-alkaline in order to um, mawala or ma-counteract na to ang acidosis. It alkalinizing agents after absorption into the blood break down in order to produce bicarbonate, which is used to alkalinize or buffer excess acid in the blood by raising its pH. Kaya the higher the pH, the more alkaline is the blood. So ato ang medicine, we have sodium bicarbonate. So it comes into preparations na atay vials. So ay vial, ato ang vial is equivalent to 50 mx, and ato ang ampule, we have the brand Solunate, is equivalent to 20 mx. So it is a sterile, non-pyrogenic, hypertonic solution of sodium bicarbonate in water for injection for administration by the intravenous route as an electrolyte replenisher and systemic alkalizer. So it is indicated for the treatment of metabolic acidosis, which may occur in severe renal disease, uncontrolled diabetes, circulatory insufficiency due to shock or severe dehydration, extracorporeal circulation of blood, cardiac arrest, and severe primary lactic acidosis. So, guys, basin da if mag-study mo pohon, information overload mo ha, ayaw lang, ako lang ni siyang gituyo og include ning other indication niya para pod namoy idea, but ang inyo halang yung importante nga i-remember is ang sodium bicarbonate is an alkalinizing agent. So, when we say alkalinizing, it would increase ang pH level sa blood in order to buffer excess acid. So, mulang na. So, mostly, ginahatag ni siya sa ato ang mga patients nga na magka-metabolic acidosis. So, na ay too much hydrochloric acid sa body. So, ang most reason ani nga magka-metabolic acidosis kay kanang sa mga patients nga na ay kidney failure. So, mo lang nang inyong i-remember. Okay, so let's proceed to our topical creams and ointments. So, first, we have calmoseptine. So, it is a combination of zinc oxide plus calamine. This medication is used to treat or prevent skin irritation such as kanang sa ato ang mga babies nga na ay burns, cuts, or crepes, or kanang na ay diaper rash. So what it does is that it works by forming a barrier on the skin to protect it from irritants or moisture. Next, we have rash free. So ang generic is zinc oxide. Brand name is rash free. So it is used for the prevention and treatment of diaper rash by preventing wetness from coming into direct contact with the skin. It also promotes healing of minor skin irritations, non-infected wounds and burns, abrasions, cuts, and sunburn. So zinc oxide, it is a skin protectant. So it acts as a physical barrier that suits the skin and prevents it from coming into direct contact with external irritants. So mostly ani ginagamit ni siya sa ato ang mga babies in order to treat kanang diaper rash kanang naipamumula sa ato ang skin sa ato ang babies. Okay, next we have silver sulfadiazine. It is the brand Burnsil. So it is used for the prevention and treatment of infection in severe burns. It is also used in other conditions like leg ulcers, where infection may prevent healing, and for the prophylaxis of infection in skin grafting. So it belongs to a class of drug known as sulfa antibiotics. So from the generic sulfadiazine. So it is it works by stopping the growth of bacteria that may infect an open wound. So it helps decrease the risk of bacteria spreading surrounding the skin or to the blood where it can cause a serious blood infection. So mostly ani ginahatag ni siya katong sa mga cases nga may infection due to paso. So ang silver sulfadiazine muna siya nga cream mostly ang gina-apply. Okay, next we have Zovirax cream. So generic name Aciclovir. It is used to treat cold sores or fever blisters like kanang herpes labialis. It can speed up healing of the sores and decrease symptoms such as tingling, pain, burning, or itching. So from the generic name Aciclovir, it is an antiviral. So it is used for treating infections caused by the herpes simplex virus. Most common ani kay kanang around sa lips. So muna siya ang atuang ginahatag, ang atuang Zovirax cream. Next, we have mupirocin. So we have two brands available na atay Bactroban and Mupicin. So it is a topical cream used to treat secondarily infected traumatic skin lesions due to specific bacteria. So most common ani nga infection kay kanang impetigo, kanang around sa mouth nato nga mga sores, sa Bisaya ana. Familiar mo ato guys kato gani.
Ugahip, ma'am.
Yes, thank you. Very good. Yeah, ugahip. So kanang ugahip, ang tambal ana is ang mupirocin. So muna siya mostly ginahatag in order to prevent or to kill the bacteria sa at mostly ana kay dapit man gud na siya sa mouth. So it is produced by the fermentation using the microorganism Pseudomonas fluorescens. So it inhibits bacterial protein synthesis by reversibly and specifically binding to bacterial isoleucine transfer RNA synthesis. So, kuan ayaw lang ninyo ni i-remember guys kay para dili ra mo ma-information overload. Ako alang ni siyang gi-include. But sa among exam ni Nori, easy lang man. So, dili lang mo na mo lisod-lisodon. Okay, next we have the combination of silver sulfadiazine plus cerium nitrate, the brand Flamacerium. So, it is used for the treatment of deep, dermal, or full thickness burns and is applied directly to the burn wound or onto a sterile non-adherent dressing. So it is an antibacterial cream used in the management of burns. So it would help to reduce risk of infection, promote healing, and in some cases, although healing may take a little longer, its use may avert surgery and possibly avoid scarring. So ginagamit nang ni siya sa katong mga patients nga naa gani ka ng mga deep nga or mga dagko nga paso mo ni siya ang gina-apply directly into the skin. Okay, next we have ketoprofen, the brand Fastum Gel. So balantayan ni siya kay naatay duha ka preparation, naatay 50 grams and 30 grams. It is used, so ang ketoprofen, di ba, it is an pain reliever, it is a non-steroidal anti-inflammatory drug. So, ginagamit ni siya in order to relieve pain, inflammation, and swelling in painful conditions that affects joints and muscles. It is very effective in treating muscle strains, sprains, back pain, and sport injuries as well as pain from tendonitis. So, since it is an NSAID, it is used to treat symptomatic relief of pain in conditions like soft tissue injury kanang na ay mostly ani kanang sa rheumatic pain or tendonitis kanang sa mga joints and muscles. So directly ni gina-apply ang Fastum Gel. Okay, next we have Facto. So it is a combination of polycrystalline plus cincochain. So it is used for the treatment of external and internal hemorrhoids associated with inflammatory symptoms of superficial bleeding, anal fissures, ragades, incised or spontaneous perforated perianal thrombosis, and post-operative wound treatment following proctological operation. So it arrests or it stops bleeding by coagulating blood protein and inducing the muscle fibers of small blood vessels to contract. So, naatay suppository ani na gina-insert rectally or naapod tay ointment. So, ginagamit niya siya para sa mga patients na naay hemorrhoid. So, katong naay internal hemorrhoid mo na siyang ginagamitan og suppository para ma-insert ni siya dito sa anom. And then for those nga kato ganing external lang, so external meaning na siya sa gawas, pwede lang siya applyan sa ointment. So muna siya ang gamit sa facto. It is for hemorrhoids. Okay, let's proceed to our Maxitrol. So, it is a combination of dexamethasone. Para unsa ganito ng dexamethasone, discuss ni Ma'am Nori ganiha, unsa gani ni iyahang classification.
Corticosteroids po.
Yes, it is a corticosteroid. So, it would reduce or it helps in inflammation. Next, we have polymyxin B and neomycin. Muni ang atuang antibiotic. So, in combination ni siya in order to treat and relieve signs and symptoms of bacterial eye infection. This medicine is used to treat conditions kanang naay swelling or naay inflammation sa mata due to bacterial infection. So muna gina-apply na siya ang atuang Maxitrol. Another brand we have Tobradex. Tobradex in combination with tobramycin and dexamethasone. So same use. It is used to relieve signs and symptoms of bacterial eye infection. So for Tobradex, it is a combination of tobramycin. So ang tobramycin, it is an aminoglycoside antibiotic which is used to stop the growth of bacteria. And then also naapod ni siya dexamethasone which is a corticosteroid so para ma-reduce ang swelling of the eyes. Next, we have terramycin. It is a combination of oxytetracycline and polymyxin B. It is indicated for the treatment of superficial ocular infections involving the conjunctiva and or cornea. So, ang importante lang ninyo i-remember is that ang terramycin, ginabutang ni siya or gina-apply ni siya sa eyes sa baby. So, paggawas sa mga babies, basig familiar lang mo nga ang terramycin na ani siya sa ato ang kit sa NICU para during after childbirth kanang mogawas na ang babies ginabutangan na ang ilahang around the eyes ana in order to protect babies from getting bacterial eye infection that can occur during childbirth. So more na inyong importante i-remember sa terramycin. Alright, next na ay ato ang lidocaine. So we have two brands na atay Silocaine and Urocaine. So it is a local anesthetic. So it prevents pain by blocking the signals at the nerve endings in the skin. So it being a local anesthetic, so if asa tong target area or target muscle nga gusto nga dito ang numbness, dito lang pud na siya i-apply. So muna siya ay kuan ni siya local anesthetic. So it comes in 20 mg per ml nga polyamp. Alright, next we have paracetamol nga bottle. So naatay two brands. We have Sanmol and Cetamol. It is used for the short-term treatment of moderate pain, mostly after surgery. So it would exhibit analgesic and antipyretic activity by inhibiting prostaglandin synthesis. Ang ginahatag ning ato ang paracetamol during or kanang after surgery kana sa ato ang mga pasyente nga magka-fever or naay moderate pain, mao ni ato ang gina-inject ang paracetamol. Brand name we have Sanmol. Alright, next we have our other local anesthetic na atay brand Sensorcaine. Balantayan pud ni siya kay we have local also known as isobaric na guys ha, and then we have the heavy. The only difference lang ani is ang ilahang duration of action. So when we inject Sensorcaine heavy, it allows for a relatively rapid motor block onset but shorter lang iyahang duration of action. And when we use isobaric or kanang atuang local nga Sensorcaine, it has a slower onset and provides a longer duration of both sensory and motor block. So depende lang sa level of pain thresholds ato ang mga patient during labor, surgery, or dental treatment, muni ang ato ang gi-inject sa ato ang mga doctors. So it produces local numbness and relieves pain. Okay, so muna ang action sa ato ang Sensorcaine. So mostly ani ato aning dispense sa OR, sa operating room, kay mupod ni siya isa sa ilahang mga ginagamit as a local anesthetics. Alright, so proceed na ta sa ato ang mga general anesthesia. So we have Propofol na atay brands available na atay Hypro and Diprivan. Asa gani ning Diprivan nakabutang? Unsa gani ang storage condition ani? Naani siya sa
Naa sa ref, ma'am, 2 to 8.
yes, very good. Oo, naani siya sa ref. Kuani siya dapat ma-maintain ang storage condition ani between 2 to 8. So Propofol, it is a short-acting medication that results in a decreased level of consciousness and a lack of memory for events. Its uses include the induction and maintenance of general anesthesia, sedation for mechanically ventilated adults, and procedural sedation. So, para dali ninyo ma-remember, Propofol, it being a general anesthetic, ginagamit ni siya or gina-inject ni siya sa atuang mga patients nga undergo og intubation. So, before sila i-intubate, gina-injectan ni sila og Propofol para ma-anesthetize sila, para dili sila makabalo, unaware sila, dili sila conscious if i-intubate na sila kay grabe kay nakasakit. So it is used as a sedative hypnotic. Muna siya ang atuang Propofol. Okay, so let's proceed to our Silocaine pump spray. So same ni siya, it is a non-sterile solution used to numb parts of the body to reduce pain and reflex gagging. So mostly ginagamit ning ato ang Silocaine pump spray kanang sa mga procedures involving nose and throat. So kuan lang ni siya, kini naani siya, it comes with a spray. So compared sa ato ang Silocaine polyam, kani siya directly lang ni siya gina-spray sa area kung asa tong examine. For example, if sa nose area ba or sa mouth or throat. So automatic lang ni siya nga i-spray. So easy lang ni siya to administer. Alright, let's proceed to our Sevoflurane. So we have two brands na atay Sevorane and Sojourn. It is an inhaled. So gina-inhale ni siya, butang ni siya together with oxygen sa ato ang vaporizer or kanang ato ang anesthetic machine and ato ang ipa-inhale sa ato ang pasyente. So it would induce and maintain a deep, pain-free sleep in adults and children. It is used before and during surgery. And then Sevoflurane, it is also a general anesthesia, meaning sa ganit basta general,
Activated charcoal, ma'am.
ang atong activated charcoal mo to siya ang ato ang general or universal antidote. Basta pag mukuan ta sa kuan ato ang general anesthesia meaning tibuok body, so mag loss of consciousness ato ang mga patient, and mostly ani sedated pud ni siya, so tulog siya, so para dili siya ang makabalo if unsa na ang nahitabo. Din mo lang ni siya kuan man ni guys ha, balantayan day ang sojourn og sevoflurane kay mostly ani gina-request kay 1,500 cc. So if 1,500 cc, pila man ka book inyong i-dispense? 1,500 pod or
6 ka
Seven, ma'am.
kuan 6 lang ka buok kay ang kuan man ni siya per cc man ni siya or per ml. So if mo request sila og 1.5, divide lang nato kay iyahang net content 250 man, mo nang mo dispense lang ta og 6 ka buok. Okay, so proceed na ta sa ato ang loose tablets. Okay, first we have sodium bicarbonate, also known as baking soda. Unsa ganito ang chemical formulation ani? N
NaHCO3, ma'am.
Yes, very good. NaHCO3, sodium bicarbonate. It is an antacid, so it would neutralize stomach acidity and is used to relieve heartburn, indigestion, or an upset stomach. Muni ang use ato ang sodium bicarbonate. Next, we have phenytoin. Katong gi-discuss ni Ma'am Nori, di ba? Previously, naasad tayo dilantine nga ampule, but karon nag out of stock pa ta. Ang ato ang gi-carry is ang ato ang dilantine capsule. It is an anti-epileptic drug, also called an anticonvulsant. It works by slowing down impulses in the brain that would cause seizures. Phenytoin is an anti-seizure medication. It is useful for the prevention of tonic-clonic and focal seizures but not absent seizures. So when we say tonic-clonic, muna siya katong type gani sa seizure nga ang tibuok body sa ato ang pasyente kay mo stiffen kaban I'm sure familiar lang mo ani. So muna siya ato ang ginahatag. And also kanang focal seizure. So focal seizure kato ni siyang naaray certain parts sa brain nga affected, so kanang unusual, an example ani sa kanang focal seizure kanang unusual gani nga head or eye placement. Excuse me, sorry guys. Mostly common ani sa kaning focal seizure kanang mga ato ang mga patients nga ni undergo og brain surgery, so naay sometimes naay unusual movement sa ilahang mata or sa ilang head. So mo ni ginahatagan pud ni sila og dilantine in order to slow down impulses sa brain para ma-minimize ang seizure. So dili ni siya ginahatag sa absent seizure. So absent seizure common ni siya sa kanang mga bata. Kabantay mo anang naay brief or sudden lapses sa consciousness kanang mukalitra og katanga ang mga babies for a couple of seconds. Muna siyang example of absent seizures, but dili ni indicated ang dilantine ana ha. So again, importante nga inyuhang i-remember, dilantine is only recommended for tonic-clonic or kanang full body ang mustiffen or kanang full body seizure, and sa focal seizure kanang sa mga patients nga ni undergo og brain surgery na ay times nga certain parts of his or her body ray mo undergo og seizure, like kanang sa mata, unusual nga movement sa mata or sa head. Dili siya for absent seizures. Na gets lang ito ninyo guys, no?
Yes, ma'am.
Okay, thank you. Okay, next we have diphenhydramine na atay brand Benadryl. It comes in two preparations na atay 25 milligrams and 50 milligrams. So it is an antihistamine. It works by blocking histamine, which is a substance released by the body during an allergic reaction. It is used to relieve symptoms of allergy, hay fever, and the common cold. It is also used to prevent and treat nausea, vomiting, and dizziness caused by motion sickness, and it can also be used to help you relax and fall asleep. Okay, another question, pohon, if ma-pharmacist na mo, and then mupalit ang inyuhang patient og diphenhydramine, unsa man inyuhang special precaution nga iingon sa inyuhang patients? Okay, guys, unsa man?
Kanang maka-cause siya og drowsiness, ma'am, compared to second generation.
Yes, very good. Okay, aside from that, unsa pa man ang inyuhang special precaution? Kinamoy idea, guys. Katutong kakiven nga it would cause drowsiness. So, since it can cause drowsiness, unsa man dapat inyuhang iingon?
Bastag mo inom ka na, ma'am, dili ka mag-drive, pwede.
Yes, very good. Dili ka mag-drive. So, much better nga to ang ingnon anto ang patients nga, ma'am or sir, diphenhydramine should be taken once daily at bedtime. Kay, kuan man ni siya, ma'am, it can cause drowsiness. So, dili pwede nga mo take ka ani if mo drive ka or if mo operate ka og special machines nga need og direct attention kay simba ko palayo. Grabe manggod ni siya og level nga maka-cause og drowsiness. So simba ko if mag-drive makatulog siya, madisgrasya buyag-buyag. So importante jud na di jud ninyo kalimtan nga for antihistamines labi na katong ato ang mga first generation mumanis siya di ba ang makakatong gingon ni Kevin nga compared sa ato ang second gen, ang ato ang first generation antihistamine would cause severe or kanang mas grabe iyahang level of drowsiness. So, mo to very good nga ato siyang ipatake at bedtime since makakos ni siya og drowsiness. Alright, next we have Isordil. The generic name isosorbide dinitrate. It is an anti-angina. It is used to prevent kung naay mga coronary artery disease, drug known as nitrates. So, di ba, ang atuang nitrates, it works by relaxing or widening blood vessels so blood can flow more easily to the heart. Alright, another question. Upon dispensing Isordil, unsa man imuhang instruction on how to properly take the medicine? Unsa man imo ingon sa imuhang patient?
Sublingual siya i-take, ma'am. Meaning under.
Okay. Yes, very good. It is a sublingual tablet. So, dili ni siya i-take together with tambal. Imo lang siyang ipa-place under the tongue. So, hulaton lang siya nga mo dissolve dito. Alright, very good. Thank you. Next, we have sodium chloride. It is an electrolyte replenisher used to treat or prevent sodium loss caused by dehydration, excessive sweating, or other causes. It is an electrolyte that regulates the amount of water in our body. Kay unsa ganito nga tuang mantra when it comes to sodium and water nga ang relationship gibalik-balik ni Dr. Lu.
Where sodium goes, water follows, ma'am.
Very good. Where sodium goes, water follows. So katuang sa ato ang mga patients gani nga naa sila'y kanang sitawag ana sorry. Imbalance ang ilahang electrolyte level in our body or dili ma-regulate ang ilahang amount of water, muni ato ang silang tagaan og sodium chloride. So it is an electrolyte replenisher nga plays a part in nerve impulses and muscle constrictions. It could also be used as an additive for total parenteral nutrition and carbohydrate-containing IV fluids. I'm sure very familiar mo sa sodium chloride kay muni inyong gi-paper tap, di ba? For a baby sa Nico, muto nag-need na siya og sodium chloride, nag-need siya og electrolyte. So muni ato siyang tagaan og sodium chloride. Alright, proceed ta sa ato ang potassium chloride. So kini balantayan kaayo ni kay almost the same lang jud sila sa ilahang pagka-color orange. So naatay 3 brands, naatay Caligen, Kalium, and K-Chlor. It is used to prevent or to treat low blood levels or of potassium or kanang sa ato ang mga patients nga na hypokalemia, ginatagaan ni siya og potassium chloride. Potassium plays an important role in maintaining the health of your kidneys, heart, muscles, and nervous systems. Potassium levels can be low as a result of a disease or from taking certain medicines or after a prolonged illness with diarrhea or vomiting. So, kanang ato ang mga patients nga mag-diarrhea or kanang grabe kay ilahang pag-vomit, magka-electrolyte imbalance na sila, and then dako jud kayog possibility nga magka-low ilahang potassium. So, muna siya ato apong ginatagaan og potassium chloride para ma-treat or ma-prevent nga magka-hypokalemia sila. Okay, proceed ta with acetylcysteine. So, same lang ni siya with fluimucil, kato ako ang gi-discuss ganiha. It is a mucolytic which is used to thin or loosen ang mucus sa ato ang throat. So, it is associated or ginagamit ni siya sa ato ang mga patients nga naay productive cough or thick ang ilahang viscous hypersecretion. So, aside from it being a mucolytic, ang acetylcysteine is used for, ganito ni siya, antidote for,
Paracetamol overdose, ma'am.
it is an antidote for paracetamol overdose. Okay, proceed now with calcium carbonate. So we have the brand Calsan. It is used to treat symptoms caused by too much stomach acid such as heartburn, upset stomach, or indigestion. It is an antacid that works by lowering the amount of acid in the stomach. It is also a dietary supplement that is needed for healthy bones, muscles, and nervous system. So aside from calcium carbonate being a dietary supplement para for healthy bones, ginagamit po ni siya as an antacid kay maka-lower man ni siya sa amount of hydrochloric acid sa ato ang stomach. Okay, if mag-dispense og calcium carbonate, unsa ganito ang ato ang dapat ibutang? I-specify na to na it is a
Chewable siya, ma'am.
yes, very good. It is a chewable tablet. So dapat jud na nato sulatan kay kuan basig mag-expect lang ato ang patient nga same lang niya siya sa other oral tablets nga intake with water. So i-specify nato dito nga chewable ni siya in order for dapat ni siya i-chew para ma-disintegrate ang ato ang active ingredient para dali mo take effect ang tambal. Okay, next we have Duodart. It is a combination of two meds na ani siya dutasteride. It belongs to a medicines called 5-alpha reductase enzyme inhibitor and tamsulosin, which is a group of medicine that would block alpha receptors. So ginagamit ni siya for the treatment and prevention of benign prostatic hyperplasia. Okay, so mostly ani ginagamit niya siya sa ato ang mga elderly men. So sa ato ang mga mostly ani sa ato ang lulo nga naay BPH or kanang enlarged or dagko na ilahang prostate. So mo manggod na mostly sa mga boys. So muni siya tuwa silang ginatagaan og Duodart in order to alleviate sa mga symptoms like mo improve ang urinary flow rate, reduction sa size of prostate, and risk of acute urinary retention and the need for BPH-related surgery. Okay, next we have betanicol chloride, brand Anika Uriflow 25 milligrams tablet. It is used to treat certain bladder problems such as inability to urinate or empty the bladder completely. Betanicol is used to stimulate the bladder to empty by stimulating the parasympathetic nervous system. It increases the tone of the muscles in the bladder to initiate urination. It can also stimulate the movement of the gastrointestinal tract. Kining Uriflow is mostly used together with Duodart kay for treatment of BPH. Kaya if naamanggoy, excuse me, benign prostatic hyperplasia, maglisod o pangihi, or maglisod sila og yes, like that, maglisod og pangihi, or if makaihi man sila very gamay lang due to the enlarged prostate. So mo ni mohatag ta og botanical chloride para ma-stimulate ang bladder para walay mabilin nga urine sa sa kuan, sa iyahang urinary bladder para makaihi lang gud ang atoang patients. Next, we have colchicine. It is used to prevent gout attacks. So, ang atoang colchicine is an anti-gout. Kuan ni siya guys, sa most manggod sa ubang patients kay makaingon sila nga pain reliever ning colchicine, but it is not. Its action is only to prevent microtubule assembly and it disrupt diya ang inflammation activation. Meaning, dili ni siya used to treat pain. Okay? It is only used para i-prevent ang gout attacks. So, gout attacks mo ni siya ang sudden severe pain in one or more joints caused by abnormally high levels of a substance called uric acid in the blood. Imo to siya ha, kay kuan magud before nag-work ko sa community, mupalit sila og colchicine para daw mawala ang sakit. So, ang murag na interpret na nila as a pain reliever ang colchicine, but if maglantaw ta sa ihang mechanism of action, dili man ni siya indicated as a pain reliever. It is indicated to prevent gout attacks or to disrupt inflammation activation sa kanyang increase na kaayo ato ang uric acid in the blood. Okay, next we have Coversil. So, generic ani is perindopril arginine. So, it ending in pril, meaning it is an ACE inhibitor. It works by relaxing blood vessels and decreasing blood volume. So, ginagamit ni siya to treat high blood pressure, heart failure, or stable coronary artery disease. Next, we have Omacor. So, combination ni siya sa eicosapentaenoic acid and docosahexaenoic acid. It is a lipid-regulating agent used to treat certain forms of increased triglycerides or fats in the body. So, ang atuang EPA and DHA, muna siya atuang mga essential fatty acids. Ginagamit ni siya in order to lower triglyceride or i-lower ang fats in our blood. Okay, next we have propylthiouracil, or in short, PTU. It is used to treat an overactive thyroid gland by reducing the formation of thyroid hormone. So it is used for ato ang mga patient nga naay hyperthyroidism. This medicine may also be used to prepare for the surgical removal of the thyroid or in addition to treatment with radioactive iodine. Kay iya mang i-inhibit or used to treat overactive thyroid gland formation sa ato ang mga thyroid hormones. So, muna siya ang ato ang PTU. Balantayan ni siya kay mao lang jud ni siya og size, color, and shape sa colchicine. So, if mag-dispense mo, make sure lang good nga if unsa tong medicine mo jud pud inyong i-dispense, labi na sa ato ang mga salads or kanang sa ato ang mga sound-alike or look-alike med. So, an example sa ato ang look-alike sa loose tabs kay ang colchicine and PTU. Mao lang jud ni siya guys. So, careful lang jud mo ha kay very different ang ilahang indication and mechanism of action. And that ends my presentation. Thank you for listening, future pharmacists. Wala ra mo'y mga question, guys. Wala ra mo'y na-miss out na slides. Hello?
Wala lang, ma'am.
Wala lang. Wala ra pud mo'y na-miss nga slides, no? Okay lang. Wala ra mo'y questions.
I think wala ra, ma'am.
Okay, thank you. Naara ko'y i-send guys nga link para sa inyo it would serve as your attendance. Thank you.
Thank you,
Thank you, ma'am.
Thank you. Bye-bye.
Goodbye, ma'am.
Thank you,
Goodbye,
ma'am.
ma'am. Thank you.
Bye, ma'am.